Hello and welcome everyone. Thank you for joining us this afternoon for this webinar to support the new gram-negative AST cards for VITEK 2. My name is Kate Donachie and I am the Senior Product Manager for Integrated Solutions. I'm joined on screen by Sinead Lindsay and Dalraj Danawa, our regional team leaders within the field application specialist teams, and both are heavily involved in all things VITEK and UCAST as well. And behind the scenes, we have my colleagues from marketing. We have Lauren, George, and Ori. So they're there to monitor the questions and answers function, which you should be able to use to place any questions in. You should be able to see a chat box with a question mark. So please do pop any questions in there and we'll come back to them at the end of the presentation. So just a little look at what we'll cover today. So we're just going to do a brief review of the VITEK AES. Now there is an extended video available on our support page if you have anyone in your lab who could do with a bit more of an explanation, maybe some new starters or some new trainees. So do feel free to check it out there. Then we'll have a look at the UCAST breakpoint information, a look at the new cards, and then we have received some questions that have come in through discussions and as part of the registration. So we'll cover them first and then go to a live Q&A then with our technical experts, Sinead and Dal. So getting right into it with a look at the advanced expert system. So I suppose the reason we're all here and we're all quite aware that antimicrobial resistance is a major threat globally, and the wide use and frequent misuse of antimicrobials globally is resulting in the emergence of those MDROs and those drug-resistant superbugs. In addition to a limited arsenal of effective and available antimicrobials, there's also very few new antimicrobials under development. So really we're facing that alarming situation with that really frightening statistic that at least 700,000 people will die every year worldwide as a result of infections by microorganisms that are resistant to antibiotics. So if nothing changes, we could face casualties up to about 10 million deaths per year. So it's essential that we really take action now and optimize the use of antimicrobials, which are still effective. So diagnostic tests then give clinicians evidence for informed decisions from antibiotic therapy initiation, optimization, and finally discontinuation. Appropriate prescription throughout this patient pathway leads to better patient outcomes, which of course is what we all want to see. Making clinical decisions based on AST results not only dramatically improves patient outcomes, but also serves that broader purpose of fighting antimicrobial resistance to help sustain efficacy of antibiotics for generations to come. Within the laboratory, I think it's safe to say that almost every sample plays some role in AMS, and bioMerieux provides a complete integrated microbiology solution designed for routine laboratory workflow from sample test preparation to result interpretation, with the goal to support antimicrobial stewardship and ultimately improve those patient outcomes. Today, 80% of our solutions support AMS, and of course the cornerstone of this in routine AST is the VITEK 2 and its Advanced Expert System, or AES. So why would you need an advanced expert system? So really, the AES is central to the strength of the VITEK. So we did want to recap on some of those aspects which are now more relevant as well as the new cards come into the market. So without the AES, you would just have the categorization, which might not be sufficient, since it ignores that a single resistant mechanism often impacts resistance to multiple antibiotics. And to help clinicians select the most appropriate antibiotic treatment, the AES automatically provides validation of every single susceptibility test result. The AES aids the validation of ID-AST results consistency and determines the resistance mechanisms supporting any changes to therapy. It will also alert on things like unusual resistance and if confirmatory testing needs to be performed. Within the VITEK 2 database, it's built to represent that diversity of encountered species and existing resistance mechanisms so that you have that robust and informative result in which you can trust. So with the latest software update, we have in our database 140 microorganisms and 118 resistance mechanisms, representing 3,892 phenotypes. All of this is made up by a representation of 59,000 MIC distributions. So as I mentioned, the AES consists of 59,000 MIC distributions, and these are a consolidation of multiple MIC values for what we call a trinomial. So that is the microorganism, the antibiotic, and the resistance mechanism. So the MIC values then are collected from publications, from internal and external data, as well as susceptibility committees such as UCAST. So MICs from a representative collection of bacteria is used to build the MIC distribution for each bug-drug phenotype combination. In the VITEK 2 AES, each of these MIC distributions are represented like this. So it's almost like looking at the graph from above. And the typicity, or how often you would see that MIC, is represented by the coloration. So you see that darker color in the center where most of your MICs fall, and it trails off then at either end of the range. You may be more familiar with looking at something like this, which is an MIC distribution from UCAST. This is the expected distribution of E. coli with ampicillin, and you'll see in the VITEK 2 software, it's the same representation with a wild type breakpoint of less than or equal to 8. So the AES system then works in 3 overall steps. So the biological validation, the therapeutic correction, and antibiotic deduction. So we'll now have a closer look at each of these steps, just looking first at the biological validation. So several phenotypes exist for the same combination of antibiotic family and microorganism depending on the resistance mechanisms. The wild type, which may have no natural resistance or no acquired resistance, and then the non-wild type, which will acquire those emerging and acquired resistance. The antibiotics on the AST card belong to several families, and in the AES database, we then have the expected MIC distributions for the phenotypes within each antibiotic family. So what you can see on the example on the screen is for beta-lactams, and you have the wild type on the left with the different expected MIC ranges for these phenotypes on the right. So as I said, in version 9.04, we now have a total of 3,892 of these phenotypes in the database. So when you get a test result, the obtained MIC values is compared with the known MIC distributions for the relevant phenotypes of the species. So in order to find the best match, so kind of like fingerprint matching. The validation of the IDAST results will also be checked for consistency. You'll get a wild type or non-wild type determination, and the resistance mechanisms will be identified. In this example, there's full consistency. So what we get is a green result. The results can be rapidly and confidently released with little or no intervention, and can also be auto-posted to the LIS for that faster result getting to your patient. The AES will propose a correction to a single MIC when one antibiotic on the entire card doesn't fit into the expected distribution for that phenotype. So this will result in a yellow result consistent with correction. A corrected MIC is proposed a corrected MIC value is proposed and will allow the isolate to match that phenotype in the knowledge base. And you will have to accept the proposed MIC change. For this case, for the example on screen, ampicillin. So having this one MIC out of range is not strange, it's just normal biological variation, but these results will be held for review. If the isolate does not match a defined phenotype in the knowledge base, because 2 or more MICs are out of range, the AES will not propose any corrections or phenotypes, and a final result will not be possible. This is also known as a red result or an inconsistent result. Red indicators may suggest technical errors or, less likely, a new mechanism of resistance. If the results do confirm and you do suspect some novel resistance in your organism, though, please do get in touch with us if you do see this and discuss sending us the isolate for inclusion in the database. So if you want to have a look at any of the phenotypes found for a specific sample, all you have to do is to click on the AES graphic, which is the little Rubik's Cube, and that will bring up the phenotypes for you. Again, the wild type will be to the left, and all other possible phenotypes for this drug-bug combination will be to the right. These are ranked based on several criteria, so that level of typicity, or how often you would see that distribution, from very typical to not very typical, and the best choices then of phenotype as well. So best phenotype down to possible phenotype. Besides the 3 confidence levels that I just described, so the green, yellow, and red, there's also an additional 2, which is the purple and black. So the purple just means that the species identified, for instance, by doing a MALDI ID, has not been described in the AES knowledge base. So it's most likely there's nothing wrong with the identification and there's nothing wrong with the obtained MICs. You just will not get any information for any phenotypes. The last one is a black confidence level, and this one indicates that there's no breakpoints defined in the software for this species for any of the tested antibiotics. The next step after biological validation is the proposed therapeutic corrections. So as you know, the test that you're doing in the lab is an in vitro test, and we all know sometimes the outcome in vivo might not fully correspond to the lab test. So to avoid therapeutic failure, the AES will propose therapeutic corrections based on the mechanism of resistance detected. So this will always be a suggested correction of the category, whereas the biological correction will be suggested correcting for an MIC value. The proposed corrections for therapeutic corrections will always be towards more resistant, so sensitive to resistant, apart from one exception, which is for oxacillin and staphylococcus, where a correction from resistant to sensitive can happen. And lastly, the last part of the AES validation for an AST result is antibiotic deduction. So antibiotics that are not tested on a card can actually be reported thanks to the AES knowledge base. This can be based on equivalence rule-based deduction or phenotypic deduction. Now, this option will have to be activated per drug that you want to deduce, and the possibilities are dependent on the drugs available on the card tested. So it is based on the composition of the cards and the information that that gives us. As the deduced drug has not been tested but deduced, only a category will be proposed. So this is now particularly relevant for the new urine card, and Sinead will go into a bit more detail with that, showing you an example with the new cards for Kepilexin. In terms of the UCAS breakpoints, because we know this is something that laboratories often struggle with and they're constantly changing, for any system currently updated to version 9.04, you will have UCAS 2020 breakpoints, as well as any interpretations, limitations and changes as per CSNs included within the AES. If you're not already aware, then there are some other options available to you, including the GCS UCAS set, which has the foundation of the 2020 UCAS set, plus all those breakpoints and bioart rules from CSNs. This will bring you to a partial 2023 set. And alternatively, you could opt for what we call our current UCAS AES set. And this will include version 13 and version 14 breakpoints to fit our cards, as well as version 10 for yeasts, which is backfilled with some CLSI breakpoints. So this includes all the CSN updates to date and some additional bioart rules. This is already available, and I know the guys are currently working really hard to get us up to version 15, which will be available soon. Just a look then at the new cards. So we have 4 new cards available. So these have been optimized to cover systemic infections, uncomplicated UTIs and non-enterobacterialis cards. These will replace the current N350, N351 and N352 cards by the end of this year. And then we have a new MDRO expansion card. This is compatible with both the systemic and uncomplicated UTI cards, as well as some other cards that are on the market. So we will keep you informed of the last availability of the older cards, but please do reach out to your account manager if you've any concerns around this once the communications come out. If you haven't already seen these cards or had a chance to have a look, there should be a brochure available to you in the handouts or documents section attached to the webinar, and everything is also available on the support page. And the IFUs for all of these cards are available on the resource centre as well, if you want to look at these in a little bit more detail.